My name is Iracema Leroi. I'm an assistant professor of geriatric psychiatry in Ireland. I work in the Global Brain Health Institute at Trinity College Dublin. With funding from the ESTA Partnership Programme under Irish Aid, we've been able to develop the International Dementia Academy for Clinicians and Healthcare Professionals in Bangladesh. And the aim of the programme is to share best practice, knowledge and understanding about dementia from health systems in the West, where dementia has been much more widely recognized, with healthcare colleagues in Bangladesh. Already, 2/3 of the world's populations with dementia live in lower and middle income countries, and this is exactly where services are least developed and clinicians have still to develop knowledge, skills, and interest in the area. Moreover, there is a real need for identifying, testing, and scaling successful brain health care interventions. However, replicating healthcare interventions from high-income countries into low-income countries is not ideal. Firstly, because access to mental health or brain health specialists is limited, there are cultural and language factors, there may be limited finances beyond research grants, and there may be also lack of national dementia policies or mental health policies.
I'm Dr. Shahriar Faruque, and I'm working in a medical college here in Shahriar Medical College, Pugla. I'm working as a psychiatrist, and I'm working in the field of psychiatry for more than the last 10 years. Though there are a lot of people, almost every two or three family has a patient with dementia, but they don't bother it actually. They don't think that it's a disease and it have a treatment and it can be controlled, or the people with dementia can live a better life. They consider it, oh, okay, it's a problem with the old age and the old man is doing some problems in making some nuisance like this. They don't consider it as a disease. So our first thing and everything we are doing, our first thing will be to make some community awareness among the people. So people should know that, okay, his or her father or grandfather or any aged person in the family, they need some service, they need some better service. That's the first thing we should do, I think, because awareness is very much less here in Bangladesh about dementia. Yeah, the culture here in Bangladesh is something different from the Western country. We have GPs also, but the first contact of the patients most of the time here, it happens to the village doctors, we say. They're not qualified doctors, they're not medical graduated, but they're trained up in medical service somehow. They're called village doctors. So most of the people of our country, actually, their first contacts is the village doctors or rural doctors, we say. So they are not, I think, very much concerned about dementia. So it's a big challenge for us. We have to train them. At least they should identify, not diagnose. I think they should not make a diagnosis. At least they should be able to identify that this patient may have dementia, so that they can refer it to a proper way, in a proper channel, in a proper place. That's the big issue. And we have also GPs. GPs are obviously they are medical graduate and they have knowledge about dementia, but the service regarding dementia or the service to the patient with dementia, where it is available, they are very much unaware about that. And at the same time, financial challenge is another challenge here in Bangladesh. So the doctors, the GP and the village doctors, they always think that it would be an extra financial burden for the family if I refer the patient to the other place, because they till now they consider that it has no fate. Actually, the patient will not be cured, but cure is not only the goal. That is the thing that they are not aware about. So I think, okay, challenge is there. We have to train these people, and at least they can identify that, okay, this patient may have dementia and he or she need to be referred to the place. In a country like Bangladesh, the government should come forward to make some initiative to serve the people with dementia, because the anti-dementic drugs that are available in the market and the service that are very much costly in terms of our perspective, because the family members are don't bother to expend so much money to survey old people of their family. Okay, we have a more stronger family bonding here. Our relatives are, we have more combined family, that we can say relatives live together. Okay, that's the thing. But when it comes to the financial issue, they don't actually want to spend money for an old person of the family, for a disease that has no cure. So the government of our country, not only our country, the government of a developing country like Bangladesh, they should come forward. They should make the drugs available for the people free of cost, and they should come forward to make some awareness, not only by arranging some seminars or online programs, but they also should use the mass media like television ads and radio ads and etc. And without the help of the government in a country like Bangladesh, it's not possible at all to make the people aware about dementia.